to my YouTube channel. This is a gynecology question. Let's see if you guys can get this right. A 25-year-old woman presents with 6 weeks of amenorrhea, vaginal spotting, and sudden severe pelvic pain. And ruptured ectopic pregnancy is suspected here. Which diagnostic procedure is performed here and what is the positive finding? Your options are option E, culdocentesis through anterior fornix, clotting blood. Option B, culdocentesis through posterior fornix, dark non-clotting blood. And option C, culdocentesis through posterior fornix, clotting blood. And option D, culdocentesis through anterior fornix, dark non-clotting blood. Yeah. Pause the video and think carefully and comment your answer before revealing it. Is option B, guys. It's culdocentesis through posterior fornix, dark non-clotting blood. Let's decode this. Why is this correct option? Amenorrhea, vaginal spotting, and sudden severe pelvic pain. You should immediately think of ectopic pregnancy. But here, it's already given as ruptured ectopic pregnancy. So, in case if they don't give you, this works for you. You can easily suspect it as ectopic pregnancy. And when the question says ruptured ectopic pregnancy, you have to like another word should pop up into your head. That word is hemoperitoneum. Because once this ectopic pregnancy ruptured, blood starts leaking into the peritoneal cavity. Like now, let's focus. Like if you guys want the basic thing, let's focus on this diagram. This is uterus as given, and this is vagina, and here comes your rectum, and this is your bladder. So this is all, this blue color part is peritoneum, and this one is pouch of Douglas. This is rectouterine pouch. And yeah, so it lies between the uterus in the front and rectum in the back. So this is where the pouch of Douglas lies. So this is extremely important because you can see this is the lowest point of the female peritoneal cavity. So whenever ruptured blood falls or flea fluid enters the abdomen, so the gravity automatically pulls it down into the pouch of Douglas. So you can think of it as a drainage pit for the female peritoneal cavity. So the basic point you have to remember here is this is more posterior, more lowest point. So blood or flea fluid automatically collects here. So why do we do culdocentesis? Let's come back here. To confirm the presence of hemiperitoneum and to aid in diagnosis and further management. Now let's come to three parts of our question. Culdocentesis is one procedure and root posterior fornix. Why do they take posterior fornix route? You can also take anterior fornix route. There are 4 fornixes for the vagina, so you can take any fornixes, right? Posterior fornix only. Why? Because posterior fornix of vagina is giving direct and easiest access to reach it. So when it is direct and easiest, what will we prefer? Yeah, that will be preferred. Next, after this, another part of our question. What is a positive finding? The positive finding is dark non-clotting blood. So why non-clotting blood? Why? Because ectopic pregnancy ruptures and blood spills into the peritoneal cavity. This we have known earlier. The blood remains in the peritoneal cavity for some time. Yes. So then it gets exposed to the peritoneal surfaces and gets agitated and defibrinated. So as you all know, fibrination helps in clotting. So if that is defibrinated, obviously clotting factors are lost. Blood loss is fibrinogen and other clotting factors. So when aspirated, it comes as a non-clotting dark blood. So, non-clotting dark blood means positive test and hemoperitoneum. Sometimes you may get clotting fresh blood. That doesn't mean that is not a ruptured ectopic pregnancy. That means, like, sometimes it also means you have entered a vascular structure. So that's the reason you call it as traumatic type. So whenever you get a clotting fresh blood, sometimes this may also be possible. So the take home point of this video is culdocentesis is performed through posterior fornix. So you can see here, I think this might not be the exact thing, but for reference, I bought this. So yeah, you aspirate, you keep the needle from posterior fornix through the pouch of pouch of Douglas, and you can also call this pouch of Douglas as Culdesac. So yeah, posterior fornix a pouch of Douglas, and this is lowest point in peritoneal cavity, and non-clotting blood is there. That positive culdocentesis is non-clotting dark blood. So this suggests hemoperitoneum. So this is a concept behind this question, guys. If you find this video helpful, please hit on the like, share, and subscribe button, and comment whoever got it right. Thank you, guys.